Okay, this is part 3 of your Kin 225 lecture for February 22nd. In this part, I'm going to go over the last factor that might cause the bilateral deficit, and that is biomechanical factors or stabilization. So as I mentioned near the start of this topic, exercises that involve movement at multiple joints, such as the leg press, lat pull down, they seem to be more affected by the bilateral deficit than exercises involving a single joint, such as knee extension or the arm curl exercise. The question here is why? It might have to do with the amount of stabilization that's involved in these types of exercise. So it seems like the more stabilization that's involved, the greater the potential for the bilateral deficit. So an exercise such as a multi-joint exercise like the leg press, it involves a greater amount of stabilization. And so you see a high bilateral deficit for an exercise such as the leg press. Whereas something like the knee extension or a hand grip exercise, it doesn't involve as much stabilization, and you see less of a bilateral deficit. So to explain this concept of stabilization, you can see from this graph the amount of trunk stabilization that's required during the bilateral leg press versus the unilateral leg press. So unilateral leg press is just using one leg, but bilateral leg press is using both legs at the same time. You can see that there's the exact same amount of trunk stabilization that's involved in both types of exercises. Now the trunk stabilization is going to help you lift a heavier weight. So in the bilateral condition, you have a certain amount of activation of the trunk stabilizers to lift weights with both legs, whereas in the unilateral condition, the contribution from those trunk stabilizers is directed only towards one leg. So you get more of an assistance with, it's easier to assist one leg lifting than two legs at the same time with those trunk stabilizers. So I've tried to summarize it in words here. Activation of trunk stabilizers is the same for unilateral or bilateral exercises. So in the previous example, it was unilateral and bilateral leg press. With unilateral exercises, all assistance from the stabilizers is directed to one limb, but with bilateral exercises, the assistance from the stabilizers has to be spread to two limbs. So you're at a greater disadvantage in the bilateral condition. So you're going to be weaker in the bilateral condition, and you're going to have a bilateral deficit. Now, the bilateral deficit has implications for the way that some people train. So in this particular study, we had older, untrained women, and they used either bilateral or unilateral contractions to train for 6 months. The question is here, who do you think had the greatest increase in muscle mass and why? So just to show you how this was accomplished, we used these types of machines that allow both bilateral or unilateral contractions. So half the women perform the exercises with two limbs contracting at the same time, and half of them did a set with one limb, and then another set right after with the opposite limb. So they did all their sets using only one limb at a time. And this is the results for, at least for changes in the lower body lean tissue mass. The upper body was similar, but this one was statistically significant. So it was the unilateral group that had the greatest increase in lower body lean tissue mass. And this is because of the bilateral deficit. So the bilateral group, if they're training bilaterally, they're going to be using a lower amount of weight for each limb, whereas the unilateral group is able to use a greater amount of weight for each limb because of the, and that's just due to the bilateral deficit, the difference between groups and the amount that they can lift. So the unilateral group is training with a greater amount of weight, and that translates into a greater increase in muscle mass over time. Now the bilateral deficit, it disappears with bilateral training, and it actually increases with unilateral training. So the question here is, what implications does this have for specific sports? So you should train specifically to your type of sport. So if your type of sport involves a lot of bilateral contractions, you should train bilaterally. And if it involves a lot of unilateral contractions, it's probably better to train with unilateral contractions in the weight room. So out of these athletes, who would have the greatest bilateral deficit for upper body strength? So there's an athlete playing football on the offensive line, there's a boxer or breaststroke swimmer. The correct answer here is the boxer, because they're using unilateral contractions on a regular basis, and that increases your bilateral deficit. So their unilateral strength would become stronger relative to their bilateral strength. Whereas the offensive line, the athlete playing on the offensive line, when you go to block on the offensive line, usually you're using contractions in two arms at the same time. So they're doing a lot of bilateral contractions. So their bilateral strength becomes stronger relative to their unilateral strength. So their bilateral deficit disappears. And same with the breaststroke swimmer. So if you think about the breaststroke, you're using in the upper body and the lower body, you're using contractions with two limbs at a time. So a lot of bilateral contractions, and that makes the bilateral deficit disappear. And the last question I have here is, an athlete such as a rower should be prescribed mainly unilateral contractions when training in the weight room. This one would be false. So a rower, if you think about rowing, it involves a lot of bilateral contractions. They should train specifically to what's involved in their sport. So it would be best if they trained in the weight room using bilateral contractions rather than unilateral contractions, strictly because it's more similar to the type of performance they need for their sport.